Okay, we're going to go ahead and get started. Good afternoon, everybody. Start out to see if, do we have any requests for bill introductions? Yeah, I think Monday is the cutoff for committee. Okay, next up, we're going to have a briefing from our Special Committee on Foster Care Oversight by Melisha. And Melisha is joining us remote.
Yes, ma'am, I am here. Can everyone hear me okay? Hi.
Yeah, we can see you and hear you.
Perfect. Okay, we can go ahead and get started then. Good afternoon, Chairperson Kincannon and members of the committee. My name is Melisha Chagan with the Kansas Legislative Research Department. This is my second session as a research analyst. This year, I staff House Judiciary, House Federal and State Affairs, and of course, House Children and Seniors. Today, I will be presenting the report of the Special Committee on Foster Care Oversight and committee recommendations. I served as support staff for this committee, and my colleague, Bob Gallimore, has staffed several of the previous legislative committees and task forces focused on foster care issues. As you know, and as the report reflects, the child welfare system is complex, but we will do our best to answer any questions you have regarding the report at the end of my presentation. And if we do not have the answer today, we will be happy to find it and provide it to you after the meeting. Before I get into the recommendations themselves, I'm going to provide you with a brief overview of the background of Special Committee on Foster Care Oversight and its activities. You should have a copy of the report that was emailed to you. In the back of the report, after the list of recommendations, you will find a summary that provides a brief explanation of what was presented in committee that led the committee to make these recommendations. The public copies can also be accessed online. There are a lot of resources that KLRD staff has made available online at ks.gov. That's ks.gov. If you have your laptops, you can click on committees, scroll down to special committees, click on Special Committee on Foster Care Oversight, and then resources to also find the Foster Care Oversight resource page. There you will find a plethora of resources related to foster care and child welfare on that webpage, including published articles and memos, which were written to fulfill specific requests made by the committee members. You will also find agendas, minutes, and testimony from that committee. You will find resources and reports from other state and government agencies on the topic of foster care and child welfare. In addition, you will find links to resource pages for those committees that looked at similar issues, which were the 2018 and 2019 Child Welfare System Task Force and the 2015 and 2016 Special Committee on Foster Care Adequacy. Now moving on to the charge to the committee by the LLC. The Special Committee on Foster Care Oversight was appointed by the LLC in 2020 and composed of 13 members. The committee was directed to receive input from families, social workers, and other stakeholders on the progress and shortfalls in the state's child welfare system, including quality of care for children in foster care, access to health and mental health services, trends and contributing factors, program outcomes from the Federal Family First Prevention Services Act, and barriers to sharing information across stakeholders, and make recommendations to the legislature on additional improvements and oversight needed to improve the child's welfare system. The LCC approved 6 meeting dates for the committee in 2020, which were held both virtually and in person. The committee met 6 times on August 25th and 26th, September 22nd and 23rd, and October 20th and 21st. At the August 25th meeting, the committee received an overview from the foster care system from Secretary Howard. It then heard from the representatives of foster care and family preservation services contractors and received a staff overview of the Family First Prevention Services Act. KDAD's representatives presented regarding waiver programs that serve youth in foster care and access to psychiatric residential treatment facilities. Secretary Howard also spoke about the foster care report card created through Executive Order number 20-53 and the impact of COVID-19 on the foster care system, amongst other topics. On August 26th, committee heard from representatives of various entities and organizations who provide services in the child welfare system, followed by an update by DCF regarding the status of technology in the child welfare system, and comments by pediatricians regarding barriers to obtaining information of patients in foster care. The committee also heard from various conferees on the topic of quality of legal representation in foster care. On September 22nd, the committee heard presentations on the child welfare system from individual conferees, providers, and organizations, followed by discussion on crossover youth and interagency communications in child welfare. On September 23rd, the committee received an overview from Secretary Howard regarding youth aging out of foster care, followed by what was called a day in the life of presentations about personal experiences of people involved in the child welfare system. The committee heard a presentation on the role of a guardian ad litem, followed by a presentation addressing the child welfare system workforce. On October 20th, the committee heard presentations about the Community Collaborator Program and the Child in Need of Care system, followed by a presentation on the impact of substance abuse in foster care, licensure of foster parents, and more day in the life of presentations by foster parents. The Chief Financial Officer of DCF provided a briefing on Title IV-E funding and responded to committee requests that were made during September meetings. Finally, on October 21st, the Assistant Revisor of Statutes discussed 2020 House Bill 2744 related to crossover youth. The committee then heard presentations regarding youth with high needs due to severity of their disability, like those individuals needing technology, nursing assistance, or specialized medical care, followed by a discussion of prevention strategies to divert children from foster care, kinship support, education, and foster care, and then closing comments from DCF. Now I will begin the recommendations. At the end of each two-day meeting, there was a discussion regarding possible recommendations on the topics discussed. Requests for further information, future presentations, and discussions were also made at that time. The following Foster Care Oversight Committee recommendations were approved on October 21st. The committee recommends the legislature establish a statutory joint committee on child welfare oversight, structured like the statutory Robert G. Bob Bethel Joint Committee on Home and Community-Based Services and Can Care Oversight, established in KSA 39-7160. The next 6 recommendations are for a newly created joint committee on child welfare oversight to pursue, provided it is established. If the newly created joint committee is not established or does not pursue the next 6 recommendations, the Special Committee on Foster Care Oversight recommends the legislature and any appropriate committee consider these recommendations. Consider establishing an office of the child advocate or independent oversight of foster care to provide independent advocacy for persons involved in the child welfare system. Look further into the Community Collaborator Pilot Program that is defined on page 22 of the summary of the October 20th meeting, and I'll go into a little bit about what that means. A community collaborator was defined in the October 20th meeting as a social worker called upon when law enforcement is responding to a child in a family situation that is in need of support services, but that family situation does not rise to the level of abuse of the child or the child needing to be placed in protective custody. A community collaborator is called upon for situations of domestic violence, welfare checks, and possible child in need of care circumstances. The next recommendation is to continue discussion and increased understanding of the establishment of a health information specialist unit in the appropriate agency with staff trained in reading medical records and able to coordinate health care for children and youth in the foster care system, and request review and input from DCF on establishing such unit in the state of Kansas. Reconsider the use of hair shaft testing for the presence of illegal substances and biological parents of children involved in the child's welfare system. Hold an informational meeting on Medicaid expansion and the lifetime restrictions imposed on families qualifying for TANF and SNAP, and the impact of those restrictions on the foster care population, and determine if there are any potential conflicts of interest or incentives for foster care contractors and grantees that affect the decisions that should be made based on the best interest of the child. The following are additional recommendations to the legislature. Urge the Joint Committee on Corrections and Juvenile Justice Oversight to consider the contents of 2020 HB 2744, addressing the crossover youth. Crossover youth are those youth involved or potentially involved with both the child welfare and juvenile justice systems, and any amendments needed. Recommends support for legislation to codify and continue reimbursement for health services, including mental health services delivered through televideo and telephone. Support the reintroduction of prior legislation, 2018 House Bill 319, regarding expediting the enrollment of foster children in school if the child has been moved from the child's school of origin and foster care or permanent family placement has not yet been determined. Support the introduction of legislation to prohibit an employer from dismissing employees who are complying with the court order requirements for purposes of reunification of their child who is in custody of the state. Those court order requirements include, but are not limited to, court appearances, appointments, visitation, and treatment programs. The following are recommendations for DCF and other state agencies. Work with the Department of Administration to explore the use of CARES Act funding for technology support for the purpose of improving safety monitoring, coordination, and efficiency within the child welfare system. Provide a comparison of benefits under grandparents as caregivers legislation, which was 2006 Senate Bill 62. Work with universities to look into the use of Title IV-E funding to support education and promote a professional track for the child welfare workforce through scholarships available during the last 2 years of education. Provide foster parents with information on continuous training opportunities available. Develop a plan of action to address the delay in obtaining school records and transferring medical records for youth in foster care. Demonstrate transparency in communicating the scope of special needs and behaviors of a child being placed with a foster family and appropriate funding placed based on the child's needs. Develop a checklist to clearly identify all court-ordered expectations at birth that a birth family must meet for unification with the child in custody of the state to be given to the birth family immediately following a court hearing. Provide information on the use of psychotropic medication as a method to subdue behaviors of children or youth who are in foster care, and report to the currently proposed Joint Committee on Child Welfare Oversight, to the legislature or the appropriate legislative standing committee. Consider mandatory training for foster parents regarding cultural competence to include the special needs of children of color and LGBTQ children. Consider the development of post-foster care housing for youth who age out of foster care. Work with the Kansas State Department of Education to explore ways to transfer funding from public school to alternative education program for expelled youth. And finally, work with KLRD to research how to develop and expand a 2-year certificate program for behavioral health technicians and guardians ad litem through community colleges and or technical schools for the purpose of creating an educational pathway into a career in child welfare. Research should include how such program would fit into the current child welfare system and how it may impact funding. Thank you, Madam Chair, members of the committee. Myself and my colleague, Bob Gallimore, can stand for questions.
Thank you, Malaysia. Committee, do we have questions on this? And first of all, I want to, if anybody is having trouble finding, I know she explained how to go through this, but if you're having trouble keeping up, so you go to the KS Ledge page and go to historical on the far right and choose 19 to 20, 2019 to 2020 session, and then go to the committees and drop down to Special Committee on Foster Care Oversight. And if anybody really wants a hard copy of it, I have one and we can make copies for you. I mean, if you're really interested in going through it. Representative Owsley and I both sat on that committee, and it was a good opportunity to learn a lot and look for gaps in the system. And I'm going to just encourage you that if you have questions about foster care as a whole, this might be a good time to ask them. They might seem real basic, but this committee has the responsibility of working on foster care issues, and there are not a lot of people who have historical knowledge of this in the legislature. So if you've got a question, especially the new ones on the committee, then somebody else probably has that question too. So don't be afraid, especially if we're using acronyms, and yeah, just stop us and we'll explain it. So I'm going to go to Representative Smith.
Thank you, Madam Chair. I'm like Madam Chair said, I don't know a whole lot about foster care. I've been around it a little bit, but don't know a whole lot. But some of the recommendations that you stated several, aren't a lot of those kind of in place already? Like health records and schooling and so forth?
Yes, sir, Madam Chair. I believe during the committee meetings, we heard specific testimony from, like I said, physicians and healthcare professionals. And as Madam Chair explained, they indicated some holes in the system. And so while some of those are in place, there are many that aren't. That's my understanding of it. Bob, would you like to add anything to that?
I had some friends that were foster parents, and I could see them, and this is several years ago, doing training and a lot of those things, but maybe they just never all came together in one committee. Maybe that's what needs to be done. Thank you, Madam Chair.
Yeah, thank you for asking that question. So it should be being done, but what we found in testimony is that it wasn't. So we need to look at changing and making it so that it works. Other questions? Representative Penn.
Yes, Madam Chair, thank you so much. I like the suggestion that you have from the committee with the person in charge of overseeing all things that are dealing with the foster care. Where was that to be housed? Was that under the governor's or the legislative? Where was that housed at?
Office of the Child Advocate. Representative Owsley.
So I've been working on this for quite a few years, and it's taken a couple different turns. Originally, it was to be housed underneath the Department of Administration, but here lately, and I've got a draft of a bill I just received yesterday afternoon, so we should see this soon. I've had a lot of people put eyes on this, and a lot of people have input on it, and currently the way it's drafted it would actually go hand in glove with this oversight committee and be housed in the legislative branch.
Thank you. Thank you, Madam Chair. I would love to see that as well, please.
Yeah, I think we'll see it when it'll come to this committee. Further questions? Oh, Representative Vaughn, you're behind the little podium. I didn't see you, sorry.
No worries. Thank you, Madam Chair. I was just wondering if you, Madam Chair, or if a member of KLRD could talk more about the restrictions that are, let's see, imposed on families qualifying for TAMF or SNAP funds in the Medicaid program.
Malaysia, do you want to respond?
Sure, Madam Chair. Yes, Representative Vaughn. Those restrictions were further explained during the testimony. I found them on page 12 in the summary. I don't have on-hand knowledge of, I wouldn't be able to explain it to you verbatim, but it's definitely on page 12 of the summary. And if you need us to go deeper into that information, we can.
Thank you, Malaysia. I think I found it. Thank you, Madam Chair.
Great question. Sure. Representative Owsley.
Thank you, Madam Chair, and thank you for the question. So the lifetime restrictions, they were put in place, I believe, in 2013. Federally, you're allowed 60 months per lifetime for access to TANF and SNAP and some child care assistance. And the state of Kansas has, over time, reduced that down to 24 months in a lifetime. And I was actually listening to a program on the way in to work the other day that they were discussing, the feds looking at the Thrifty plan, which are our SNAP or our food assistance, supplemental nutrition assistance program, is based off of, and how outdated it is, and how a family of four has to make less than $34,000 a year to even qualify for it. However, again, the federal lifetime eligibility is 60 months, and currently in Kansas it's down to 24. I think a strong point was raised during that program that if the pandemic's done anything, it's really put, the needs of our neighbors on a stage, with kids being out of school and maybe eat more meals at home and being responsible for this. So I think that now would be timely to look at that. And again, that's another thing that I hope this committee can address. Thank you, Madam Chair.
Thank you for those added comments. Other questions? Representative Neighbor.
Thank you, Madam Chair. I just wanted to make a comment, if I could, real quick. On the delay of school records and medical records, it is the law in Kansas, if it is a special needs child, a gifted child, or anything like that, they have to get those records and provide those services within 10 days. So that is in the public school system, not in private, but certainly there is a law there in place that if you have a child in that arena, that you've got 10 days to get them back into the services that they need. So that would include foster kids or anyone.
Malaysia, did you have anything to add to her comments?
No, I did not, Madam Chair. Thank you.
Representative Owsley.
Thank you, Madam Chair. And just to expand upon that, that's what the Deputy Commissioner, when he was in front of the Oversight Committee, also said, that if that's not occurring and you know what school district or principal or superintendent to, please give that specific case to them so that they could look into it. And ideally, the system should flow and the guardrails should be in place, but as the chair said, that there are holes in the system, and we'd like to close as many of those holes and make it as seamless as possible.
And in the day and age of computers, it shouldn't be that difficult to send records, but for some reason, they were not being passed along. Representative Mosier.
Thank you, Madam Chairman. I will be the first to say that I don't have direct experience with foster foster care, but my aunt was, I don't have direct experience with foster care, but my aunt and uncle were foster parents all the while my cousins and I were growing up. My cousin out of that family has been a foster parent all her adult life. And she approached me this summer about this particular committee. And she said, all I can tell you is that the foster care system needs help. It's broken. So thank you to everyone who's worked in that arena, and let's all work together to make it better.
Well, thank you for your comments and for your willingness to serve on this committee and have a personal experience, be passionate about it. Any other questions? Okay, thank you. Thank you, Malaysia. Okay, we'll open the hearing on House Bill 2115, establishing the Joint Committee on Child Welfare System Oversight. And we will first off turn to Jesse for an overview of the bill.
Thank you, Madam Chair. Members of the committee, House Bill 2115 creates the Joint Committee on Child Welfare System Oversight. And that committee would review the following topics: data on child maltreatment and demographics, the duties, responsibilities, and contributions of DCF, KDADS, KDH&E, corrections, law enforcement, and the judicial branch that all make up the child welfare system. And then review also the grants and contracts by all of those same actors as they impact children and families involved or at the risk of becoming involved with the child welfare system. And that includes the prevention and investigations of child maltreatment, in-home family services, foster care, reintegration, and adoption services. The committee will also review trends, performance outcomes, activities, and improvement plans related to the federal child and family services reviews, reports from child welfare related groups, the implementation of the 2019 Child Welfare System Task Force report recommendations, reports on concerns received by the Kansas Department for Children and Families, Child Welfare Ombudsman, or their customer service department, or any similar office. They'll review opportunities to strengthen the child welfare system and review any other topic that the Joint Committee deems appropriate. The committee will have the following members: 2 members of Children and Seniors appointed by the Speaker, a member of Child and Seniors appointed by the House Minority Leader, 2 members of Public Health and Welfare appointed by the Senate President, a member of Public Health and Welfare appointed by the Senate Minority Leader, 2 members appointed by the Speaker, 1 member appointed by the House Minority Leader, and 2 members appointed by the Senate President. So the first chairperson of this committee would be selected by the Speaker from the Speaker's appointments on that list within 30 days of the effective date of this section. The chair and the vice chair will then alternate between the Speaker and the President's appointments, and the ranking minority member of the Joint Committee shall be from the same chamber as the chair and appointed by the minority leader of that chamber. The Joint Committee shall meet upon the call of the chair, at least in January and April during the session, and at least once in the 3rd and 4th quarter of each year. There shall be no more than 6 meetings a year, and a quorum for the committee will be 6 members. The Joint Committee shall submit a report annually to the President, Speaker, Children and Seniors, and Public Health and Welfare Committees. The report will include recommended changes to current laws, rules and regulations, and policies regarding the safety and well-being of children in the Kansas welfare system. The bill also grants the Joint Committee the power to introduce legislation. These members on the Joint Committee will be paid the substance for attending any Joint Committee or subcommittee meetings, and the LCC shall provide any professional services requested by the Joint Committee. And House Bill 2151 would be effective upon publication in the Kansas Register. I'm available to take questions regarding House Bill 2115.
I'm slow opening this up. What's the fiscal note?
Let me check. The fiscal note has would increase expenditures of LAS by $30,000 from the state general fund, and expenditures for the 11 members for their salaries, substance, mileage, etc. would be $25,949. And then the committee assistants would, their assistants would cost $4,060. And that are the numbers that are in the fiscal note. It could have a fiscal effect on the judiciary for any of their involvement, and the OJA has not indicated the amount of those costs.
Okay, thank you. So the 30,009 is the total, and the others are the sentences following that are the breakdown. Okay, so we'll go. Oh, do we have questions for Jesse? Okay, thanks, Jesse. We'll move to the proponents, and first up we have Secretary Laura Howard from DCF.
Goodness.
Secretary Howard?
Yes, I'm here. For some reason, I'm having trouble with the video. Can you hear me?
We can hear you. We can't see you.
Okay, you can't see me. I apologize. I continue to try to start it, and it's telling me I've got a conflict here, but
that's okay. We'll just listen to you.
Yeah. I'm going to be very short anyway. I really just wanted to come and lend my support to the legislation. You know, I stand strongly in support of House Bill 2115 that would create a standing joint committee on child welfare oversight. You know, I believe very strongly in the role that the legislature oversight across government. And I think there's probably few places in government where that's as important as thinking about foster care and the child welfare system, where we have children who are in the custody of the state. I think that makes it just incredibly important to have that oversight and really to work across branches of government. You know, I had the opportunity this summer and fall to connect with the Special Committee on Foster Care Oversight, chaired by Representative Kincannon this summer. You know, myself and my team participated in every meeting. It was a great opportunity both to educate and to listen and to learn. Very, very valuable way to gain feedback. And I mean, I just might, just as an example that goes back to some of your discussion a few minutes ago, we're already using those recommendations to implement practice improvements. I think the issue of school records was brought up, which is, you know, that's been like an ongoing issue as long as I can recall in the child welfare system. But we've already made, you know, improvements since these recommendations where we've worked with our case management providers for some specific action plans on improving those and how those would be monitored and reported going forward. So again, just one example of how we've been able to use those feedback and recommendations to continue to improve the system. I think lastly, I would just say, you know, I am very proud of the progress that we're making in Kansas in stabilizing our child welfare system and in laying the foundation for long-term success. Now, I'm proud of the reductions we're seeing of the number of youth in foster care, the increases and the effectiveness of our new prevention programs. And also, you know, of how much stability in terms of child moves have improved in the system. But I also know that I'm not satisfied and there's a lot more work to be done. So I'm eager to continue this work with the support of the legislature. And I hope to have the opportunity to continue that partnership with an ongoing joint committee on child welfare oversight. So thank you, Chairman.
Thank you. I think we'll go ahead and take questions for the secretary now. If we have, there you are.
Now I'm on video.
Representative Owsley.
Thank you, Madam Chair, and thank you, Madam Secretary, for being here. Thank you for your participation in the Oversight Committee over the interim, and thank you for weighing in upon House Bill 2115, and thank you for putting the fiscal impact of the legislation in your testimony. That is, it's all appreciated. That's all. Thank you.
Thank you.
Okay, any further questions? All right, thank you, Madam Secretary.
Thank you.
Okay, next up, Rachel Marsh, Children's Alliance of Kansas.
Good afternoon, Chair Concanon, Vice Chair Esau, Ranking Member Owsley, and members of the committee. My name is Rachel Marsh. I'm the CEO of the Children's Alliance of Kansas. My background is I have a joint degree in law and social work, and I have worked in case management, children's advocacy centers, child welfare law, juvenile and adoption law for over 20 years. I represent the Alliance, that is an association of 18 private nonprofit child welfare agencies that provide child welfare services. We're moving now to trying to start to call it the family well-being services. Our members provide interventions that are designed to prevent the circumstances that lead children to coming into care, support children and families involved in foster care, and support the success of children and families once foster care is completed. Our members serve children in every county and community in Kansas. We appreciate this committee's consideration of HB 2115 and support the establishment of a standing committee focused on child welfare systems improvement. I just wanted to highlight how children in our state have benefited from the attention turned to foster care from the Child Welfare Systems Task Force in 2017 and 2018, and from the Special Committee on Foster Care Oversight during the 2020 interim. In the Child Welfare Systems Task Force, that helped us to be one of the first states to adopt the Family First Prevention Services Act programs, which, as Secretary Howard mentioned, has helped us to safely reduce the number of children in foster care in Kansas significantly. This has helped with placement stability, placement capacity, and quality of care, given the workforce challenges that cross the state in social work and mental health. The task force also was where providers were able to raise the issue of access to psychiatric residential treatment facility beds being inadequate, and that we needed to focus on reducing the wait list for those children who are medically needed psychiatric care and who were not able to get that care. Subsequent to this, with the support of Secretary Howard, KDADS has added nearly 100 beds and quite significantly reduced the wait list for PRTF services. These are just two examples of what it takes to really focus on child welfare systems issues deeply, examine the root cause, and then produce recommendations that can be really helpful, that really have tangible benefits for children in foster care. Like Secretary Howard, I also attended the special committee last summer, and I thought that the conversations there that facilitated by Chairwoman Concanon with the support of Ranking Member Owsley were some of the best conversations we've had in child welfare at the legislative system in years. There was an understanding with the long-term commitment that these two leaders have brought of the complexity of child welfare and how we need to look at across the systems, across providers, across silos to look for solutions, such as the ones mentioned earlier. Many of these issues that you heard from the recommendations are cross-systems issues: education and child welfare, mental health and child welfare, juvenile justice and child welfare. So we believe that in order to lead ongoing improvements in child welfare, a standing committee is an excellent approach to this. Something we say in child welfare is that the only constant in child welfare is change. There are issues of federal laws, state laws, federal policy, state policy, trauma-informed care, emerging best practices, and evidence-based practices, and something new is coming out nearly every day. A standing committee that's willing to dive in and learn and understand these systems can help Kansas stay up with data, trends, opportunities, for sustained improvement. And we can continue to be up on what's going on now, so that when we get better, we aren't satisfied. Again, as Secretary Howard mentioned, we can continue to look at ongoing improvement. So we just thank you for the consideration of this standing committee and stand-in support. And I'm happy to stand for questions at the appropriate time.
Okay, we'll do questions now. Do we have questions for Rachel? Representative Ousley.
Thank you, Madam Chair, and thank you, Rachel, for being here and your testimony. And I wanted to point out to the committee members that at the bottom of your testimony, it lists the members of the Children's Alliance, and I wanted to make a point of clarification that you do speak on behalf of all these different groups underneath that heading.
Yes, thank you for pointing that out. We do try to list the members because they are providers across the child welfare system in Kansas who have seen the benefits of legislative focus on this issue.
Thank you, Madam Chair.
Okay, further questions? Rachel, thank you for your kind comments about the work of the committee. Hope we can continue.
Thanks.
Thank you. Any other questions? Okay. Thank you. Next up, we have Mike Fonkert from Kansas Appleseed.
All right, can you hear me?
Yes, we can.
Perfect. Well, thank you, Chair Concanon and Vice Chair Esau and Ranking Member Ousley. My name is Mike Fonkert, and I am the Just Campaign Coordinator for Kansas Appleseed, and I'm happy to be here today to support this legislation. As has been touched on already, House Bill 2115 is an important part of establishing oversight and accountability for our foster care system. As many of you know, we still have a long ways to go to fix our foster care system, and we continue to see various crises across the system. Too many Kansas children are in foster care, and they are entering at racially disproportionate rates. Right now, Kansas kids are staying for longer than previous, while high levels of instability remain. Fewer than 17% of children in foster care attend the same school that they did prior to entering the system, and the graduation rates for foster care kids who aged out of the system this fiscal year was only 16.4%. Meanwhile, on racial disparities, Black children in Kansas were 2.08 times more likely than white children to be in foster care. Also troubling, more than 11% of kids that are leaving the system right now are re-entering within 12 months. These are all troubling statistics and highlight the need for continued oversight. I was pleased to listen in and see the work of this Special Foster Care Oversight Committee throughout 2020, and the stories and the platform for folks to speak that it provided. There was a lot to take in for the members, and I'm excited for folks to put forth the willingness to dive in and learn and really study these issues. I do want to be clear, though, that we do not believe this is the only solution. This is only one part of the puzzle that we're trying to put together here. It will be very difficult, as it is for all legislative committees, for legislators to truly become experts on these systems when they'll only meet as many as 6 times a year. Those meetings will be very important to inform those policymakers and for them to inform their reports for the rest of the legislature. But it doesn't eliminate the continuing need that we see for robust, professional, independent oversight. Something like has already been mentioned, the Office of the Child Advocate. And so we want to keep working. This is a great first step, but something like the Office of the Child Advocate would provide the 7-day a week, 12-month a year kind of information and on the ground action that would be able to fully inform a committee like we're talking about today. That being said, I think this is a great step, and we would love to see this bill passed. I would caution the committee on one other aspect that potentially could be looked at, which is, by my math, it looks like it'll be an 8-3 split along partisan lines, and that is what it is. But we certainly recognize that the best policies in government tend to get made when we really focus on working together. And so I wanted to highlight that as something that perhaps the committee could address to make sure that we are representing the full spectrum of folks in the legislature on that committee. So with that, I will close. Again, this is a great first step, and we're happy to support this bill. And we thank you all for your time, and we look forward to continuing to work with you all to improve the foster care system in Kansas. And I will stand for any questions.
Thank you. I might just say on the partisan split, I hear your recommendations for that. I will say that this was framed after the Bob Bethel Can Care Oversight Committee, and that was, it reflects the ratio in the House and Senate combined. And we did, at one point, we adjust those numbers. So it's not like it's the end-all be-all, and I certainly understand the point about the ability to make better legislation when we have all the voices there. Questions for Mike Bunkert. Representative Johnson.
Thank you, Madam Chair. I'd like to thank you for all the work your committee does and your recommendations. Just for me, you made a very good point on the effect for African-American children and the foster. Was there any facts or numbers for us on Hispanic children?
So there certainly is data collected for Latinx youth. I do not have that included in my testimony today, but we certainly have that data available. DCF has that data available. I would be happy to follow up with you and pull that.
Thank you very much.
Thank you. And if you would share that information with my office, then we'll distribute it to the whole committee.
Will do.
Other questions? Okay. So the rest of the proponents are written only. We've got a letter of support from Majority Leader Dan Hawkins, Representative Susan Humphreys, who sat on this. She was vice chair of this committee the last 2 years. And from Lee Flitter, Director of Government Relations at the Kansas Association of School Boards. And I show no neutral and no opponents. So with that, we'll close the hearing for House Bill 2115. Okay, we're going to take a look at House Bill 2062, and Fran has emailed that to you. So if you have your computer, you can pull that up quickly and have that in front of you. What would be the committee's wishes? Representative Ousley.
Madam Chair, I move that we pass out HB 2062 favorably.
Okay, it's been moved by Representative Ousley and seconded by Representative Johnson to move House Bill 2062 out favorably. And committee, you'll recall this is the bill that was necessary for the Child Death Review Board to be able to store and access data. So is there any discussion? Representative Ousley.
Thank you, Madam Chair. And as I had brought up a Wyandotte County review panel a couple of times during this committee hearing, I wanted to let committee members know that I've since spoken with both the Wyandotte representative and members of the Child Death Review Board, and they believe they can get that done without legislation, and if they can't, we will readdress that at a later date and time. But right now, it's of the understanding that they can get that information without having an amendment to this bill, so I stand in support.
Representative Esau.
I'd also like to add that we thought when we were trying to pass this last year that it would save us $10,000, and now it won't, but that is only because the computer system is on its last ability to be updated. No one's keeping it maintained, the system. So it'd be nice to avoid a crisis in how we use the data.
Any questions or discussion? Representative Wagoner.
Just a question from last year. Of course, it did come out of this committee like a year ago and went to the House. Was it unanimous in the House? Or what was the vote? Do you remember? It was pretty non-controversial, right?
I think it was 123 to 1.
Okay. There's always one.
Oh, was it?
Okay. Thank you.
She would know. I think Representative Ousley or Esau carried that bill, right? Yeah. Yeah. So yeah, it passed this committee and it passed out of the House, and then it was lost in the whole shutdown. Any other discussion? All right. So the question is, move House Bill 2062 out favorably. All in favor say aye. Aye. Opposed, no. All right, we passed a bill. Our first one. Yeah. All right, that's all the business I have on my agenda. I was going to tell you what we were going to do Monday, but I don't have that with me. Yeah, so we've got, coming up, we've got a lot of bill hearings Monday and Tuesday. And then we're also next week going to hear a report from Melissa Rooker at the Kansas Children's Cabinet. And yeah, we'll work some of the bills that we've already heard. So I don't know that they're listed on there right now, are they? Yeah. So we've got possible final action. So if you have any interest in amendments or the bill, you might take a look at it before we work it. All right, with that, we're adjourned.